Hi, how are you? I'm Prince, and today I'm going to be demonstrating on how to perform NG tubing. So my patient is 65 years old, Miss James, and her doctor ordered her NG tube. So in performing these procedures, before I begin, um, let me tell you what is NG tube used for. It could be used for feeding or to insert medication for a patient that has difficulty swallowing, or you could use NG tube to remove toxins. So first of all, when you come in, you want to provide the patient with privacy, wash your hands, and identify the patient by name and date of birth. Like, hi, how are you? I'm Prince. I'm nursing student from Mansfield University. Can you please tell me your name and date of birth? Oh, that's nice. Okay, I'm just confirm that. Look at the patient wristband. Okay, good. And you want to tell the patient, what you're gonna be doing, because you always want to inform the patient of any procedures that the doctor have ordered. Like, okay, so I'm gonna be inserting an NG tube in you today because the doctor have ordered. Is that okay with you? Okay, great. So once you do that, make sure the patient is in a half follow position to prevent aspirations. For the sake of this video, I already did that. So yeah. So your next step is gonna be to measure the NG tube. So in order to do that, you wanna like first determine which narrows the NG tube is gonna be going into. So to do that, you can use a light pen and identify the area. Okay. So I'm gonna use my left nares. But anatomically speaking, the right nares is larger than the nerve nares. But there is like some indication that can affect these procedures. Like if your patient has a nose trauma, or if they has like a broken nose, or if they own like a tender, which is another contraindication. You don't want to give them to them because you can poke a hole through the nose that can cause like a continuous bleeding. So I've already selected the part I'm going to insert the tube in. Next step is going to be open your tube kit. And one thing you should know is that this procedure is a clean procedure. It's not a sterile procedure. So open my catheter kit. Now I can go ahead and wear my gloves. And I'm going to measure my tubings on the patient. So on the kit, the blue tube is like a filter. It's used to prevent air. It's used to filter the air from to prevent the tubing from attaching to the patient on side of the stomach. So now I'm gonna measure my tubing, and how you do this is from the nose to the ear and to the subway process. So I'm just gonna measure the tubing on you. Is that okay? Okay, great. So from my nose to the ear, the lobe of the ear, and now from the ear to the subway process, which is approximately right there, is about 40 inches. And I am going to wrap this tube around my fingers to soften it a little bit, and it helps promote the tube to enter on the patient trach easily. So you gonna insert your tube into the water soluble lubricant, 3 to 4 inches. Okay, that's gonna help provide facilitation. So now you wanna like have your patient put the head back, but since this is a mannequin, I am gonna like Push your head back, and I am gonna insert the loops, the tube into her nerves until you feel a resistance. Okay, so now you feel the resistance. You want to ask them to pull the head back. If you watch while you're doing these procedures and the patient start gurgling, it means that it's in the trachea. So you want to like give them the water and ask them to take a zip each time as you continue. Okay, so my patient is gonna hold this water up, and they're gonna pull the head backward for me like this, and I'm gonna ask them to take a zip every time. Can you take a zip from me? Can you
Sip,
take a zip from me?
sip,
Can you take a zip from me?
sip, sip,
Can you take a zip from me?
sip, sip,
Can you take a zip from me?
sip.
Can you take a zip from me? Can you take a zip from me? And continue. Can you take one more? Okay, so after you had done that, you can take the water out, and you want to put this up here because now I'm about to like check for like placement of tubing. So I'm gonna put it over there, and to check for placement of tubing, you can use like three. You can do like the pH, and the normal pH should be at least 5.5, and you can also do like the color, the full color, the content, and you can do chest X-ray, which is the gold procedure, or the gold standard. But in this video, like I don't have a chest X-ray, so I'm not going to do that. So I am going to check for placement of tubing by using my syringe. How you do this is that you use the syringe and put it into this port right here, and you want to aspirate on there to get the content of it. Normal color it's gonna look like greenish, brownish, or yellowish. So once you do that, you can actually put this back in. And after you are done with that, you want to secure the tube around the patient nerves. So to secure the tube, this part is gonna go on the patient nerves, and this is gonna go around the tubing.
What is the blue balloon and the hemisphere used for?
The balloon is inflated, that means the trachea is stabilized, and it is shutting off the oxygen from the nose and mouth, and making sure that it breaks.
Also, what should
Okay,
you also
so
have
now my tube is secure. Now my tube is secure, and that's it. So now I'm gonna assume like my doctor had ordered like some food for my patients, or like he ordered like 300 milliliters of milk for my patient every 3 hours or every 4 hours. Assume every 4 hours in this video. So I have like 300 milliliters every 4 hours, and now I gotta come back and perform or give my patient a feeding. So what I'm gonna do is I'm gonna come back in the room. I'm gonna apply the same standard procedures, identify my patient by name and date of birth, provide hand hygiene, and wear my gloves and all that. And I can, before you do this, every time you come back to the room, like you always want to check for placement of tubing, because the tube could be within the patient trach or in the patient lungs or something. And while I was doing the video, first of all, like every time you are inserting like a tube, every time you're inserting a tube and you notice that the patient start to cough or that O2 side decreases or something like that, you want to remove the tube because that's like a clear indication that's in the lungs. Okay, so now I am gonna come in. My doctor have order of 300 milliliters of milk of full liquid diet for my patient every 4 hours. So to do that, you want to check for placement of tubing. Okay, check for placement. Okay, that seems good, and now you can put it back in. And you can also do like the residual. You can also do the residual, and the residual is like the food that left in the patient abdomen or in the patient's stomach after the 4 hours. So like like after 4 hours, she had like 400 milliliters of full liquid, and now I'm gonna check for residual. To do procedure, you're gonna remove all the food content that's in the patient's stomach. It's a continuing process. Put it in here. So you want to do this continuously until there is no more food content that can come out. And once you're done with that, you want to measure how many milliliters in here. And here my patient has like only 100 milliliters out of 300 milliliters. It means that my patient is digesting the food properly. But in the case that the patient has like the same 300 milliliters or like 280 milliliters, it means there is like lack of peristalsis or something like that. It means the patient is not digesting the food properly. So you do not want to give them that food if they're not digesting the food properly. But if they are digesting the food, then you want to give them the food the doctor ordered. So I'm going to give them the food back since they have 100 milliliters. To do that, you got to remove this first. And now I'm going to put this in here. And I'm going to use a gravity feeding by doing this. Put my food back and put it up here. And this is called the bolus feeding. Put my food in here, put it up there, make sure it's going in, and make sure they have all that food that came out, and then plus the food that doctor ordered, you want to give it to them too. And every time you do that, you want to flush the tube, so you can use a water or a normal saline. So in this case, in this video, I'm going to use a normal saline solution. So I am going to put the water in here, and there we go. So this is it. In a situation that the patient is on a continuous feeding diet or something, like you want to like a continuous feeding is like it's like an IV feeding, but it goes in the stomach instead of like the IV. Okay, so after you're done with that, you can actually like clamp your tube back and put it over you. So in the situation that I have to do like in the situation that I have to do like suctioning on the patient, you're gonna come back in and do like the same standard procedures, and you're gonna use like your suctioning tube, which is right here in this video, and you're gonna remove this support, and you're gonna put this in here, and you connect your suction kit to it, and you can do your suctioning. But I'm not gonna do suctioning in this video. Okay, so this is how you insert an NG tube. So now I'm going to talk about removing an NG tube, right? So if you want to do the procedures, like you can come back in the patient room and introduce yourself to the patient and do like the same standard procedure, or wash your hands, wear your gloves, and tell the patient what you're going to be doing. And once you're done with that, you can ask the patient to take a nice deep breath for you and hold it. And before you do that, you gotta remove this from on there. Okay, and now you're gonna ask the patient to take a nice deep breath for you and hold it. That provides relaxation of the muscles, and you wanna remove the tube as fast as you can. Okay, and you can put this in the trash. So after you're done with that, you want to provide like an oral care for your patient. So you want to like clean up your patients and make sure the patient is left in a comfortable position. Reduce the bed down to like a lower phallus position. And that's it. Thanks for watching and have a good day.